Imagine reaching for that little jar of jelly sitting in your bathroom cabinet, the one you trust to soothe dry skin, protect cracked lips, or heal minor burns. It looks harmless, clear, and silky smooth, something we apply without a second thought. But what if I told you that same jelly was once nothing more than a thick, slimy, pitch-black sludge scraped off oil rigs in the mid-1800s? Back then, workers cursed the sticky mess for slowing down their drills and staining their hands. Nobody could have imagined smearing that grimy residue on human skin, let alone turning it into one of the most trusted household remedies in America. And yet today, over 125 million jars of Vaseline are sold every single year. The journey from dirty industrial waste to a globally beloved balm is one of the most unlikely transformations in consumer history, and it starts deep in the oil fields of Pennsylvania. Back in 1859, when America's oil boom was just beginning, roughnecks noticed something strange. That black sludge they despised seemed to help small cuts and burns heal faster when rubbed onto the skin. While most men dismissed it as coincidence, one young chemist named Robert Chesebrew saw an opportunity where others saw waste. He spent years experimenting, refining, and purifying the substance until he produced a pale, stable jelly that was no longer dangerous but soothing and protective. By 1872, he patented his discovery, gave it the name Vaseline, and began selling it as a miracle ointment. From that moment forward, Vaseline wasn't just another product. It became a household staple, passed down from one generation to the next. What started as a nuisance on oil rigs grew into one of the most enduring health and beauty products in history. To understand just how remarkable this transformation is, we need to look at where Vaseline actually comes from. Its story begins with crude oil, a dense cocktail of more than 500 hydrocarbons trapped underground for millions of years. When oil is pumped to the surface and delivered to refineries, it doesn't look anything like the clear fuel we pour into our cars. It's a heavy, sticky black mixture that has to be separated inside towering distillation columns, some rising nearly 160 feet into the air. As the crude is heated, the lighter molecules like gasoline, kerosene, and jet fuel rise to the top. The heavy fractions that no engine can burn sink to the bottom, forming a thick, waxy residue known as slack wax. At first glance, slack wax looks completely useless. It's dark, sticky, and smells unpleasant. But without isolating this fraction, Vaseline could never exist. Of course, slack wax fresh out of a distillation tower is far from safe. It carries toxic residues, heavy aromatics, and impurities that make it unusable on the human body. This is where modern refining steps in. The first major purification stage is vacuum distillation, a process that allows the wax to be heated close to 300 degrees Celsius without breaking apart its molecular structure. This step strips away unstable fractions, leaving behind the beginnings of a jelly-like base. Next comes filtration, where bleaching clay and activated carbon act like sponges at the microscopic level, removing color, odor, and impurities. After several cycles, the transformation is dramatic. What started as grimy, black sludge now looks pale and smooth, a substance that could finally serve as the foundation for a safe product. But appearances alone aren't enough. Even after heavy refining, petroleum jelly still carries the risk of containing trace levels of harmful compounds like polycyclic aromatic hydrocarbons, chemicals linked to cancer if left unchecked. To guarantee safety, every batch undergoes strict screening under international standards. Instruments sensitive enough to detect parts per million measure impurities, and anything above 0.1 ppm is rejected immediately. Beyond chemical purity, the jelly is also tested for clarity, odor, and stability. It must be inert, meaning it doesn't react with skin or the environment, and it has to remain consistent in texture over time. Think about it, would you ever smear raw oil residue straight from the ground onto your lips? Probably not. But once it passes this gauntlet of safety checks, that once filthy substance is now medical-grade petroleum jelly, ready to become Vaseline. From here, the process takes on a surprisingly delicate touch. The jelly, still warm and semi-fluid, is transferred into massive stainless steel vats where it is gently stirred at about 70 degrees Celsius. This temperature keeps the product soft enough to blend evenly without damaging its stable structure. Some variations may receive additives like vitamin E for extra skin benefits or light fragrances for cosmetic lines. But the classic version, the one most of us grew up with, is left completely pure. Nothing added, nothing taken away. Just petroleum jelly in its cleanest form. Once ready, the jelly moves to automated filling lines. Sterilized tubs and tubes roll down conveyors, each one filled with precise amounts ranging from 100 milliliters to family-sized jars. The machines work at lightning speed, up to 400 jars every minute, before sealing and stamping them with batch codes for traceability. Within hours, what was once dirty refinery waste has been reborn as neat little jars of Vaseline, shipped to pharmacies and homes across America and beyond. From cracked winter lips to diaper rash to healing tattoos, Vaseline is proof that even the most unlikely substances can be transformed into something safe, useful, and trusted for generations. But Vaseline's story is just the beginning. Another product, also born from the same petroleum base, carries with it a different kind of legacy. For millions of Americans, opening that small blue jar releases a sharp menthol scent that instantly floods the mind with childhood memories. It's the smell of comfort, of a mother sitting by the bedside, rubbing a cool ointment on her child's chest during a long night of fever and cough. That product is Vicks VapoRub, a medicine cabinet staple that has been soothing families for well over a century. The origins of Vicks go back to the late 1800s in North Carolina, where a pharmacist named Lunsford Richardson began experimenting with new remedies. One of his most successful creations was a salve designed not to be swallowed like traditional medicine, but inhaled through the nose and lungs. At a time when most cold treatments involved harsh tonics or untested syrups, this was revolutionary. Originally sold under the brand Vicks Family Remedies, the ointment quickly grew popular in local communities. Its defining moment, however, came in 1918 during the Spanish flu pandemic. As the deadly virus swept across America, families desperately searched for anything to bring relief. Demand for the blue jar skyrocketed, and millions of units were sold nationwide. From that moment on, Vicks wasn't just medicine, it was a cultural symbol of care, comfort, and resilience. The magic of Vicks lies in its ingredients, and once again petroleum jelly provides the stable foundation. In modern factories, massive steel vats are loaded with purified jelly and heated to around 70 degrees Celsius until it melts into a uniform liquid. This base undergoes further filtration to ensure absolute purity, leaving a silky, odorless canvas ready to absorb powerful aromatic oils. Menthol, camphor, and eucalyptus oil are the stars of the formula, each one chosen for its ability to ease breathing and reduce discomfort. Menthol provides that icy cooling sensation, camphor delivers soothing warmth, and eucalyptus oil opens up the airways with its crisp herbal notes. Together, they create the unmistakable scent that has comforted generations. Blending these potent oils with petroleum jelly isn't as simple as stirring them in. Precision is key. Too much menthol or camphor could irritate the skin or overwhelm the senses, while too little would make the ointment ineffective. That's why every batch is carefully measured and mixed under strict quality controls. Once blended, the ointment is cooled, thickened, and poured into those iconic blue jars, each one carrying not just a product but a piece of American family history. Today, more than 60 million units of Vicks VapoRub are sold worldwide every year. But numbers only tell part of the story. For countless families, the scent of Vicks is as nostalgic as the smell of fresh-baked cookies or holiday pine. It represents the moments when care and comfort mattered most, when a simple act like rubbing a soothing ointment on a sick child's chest meant everything. Just like Vaseline, Vicks shows us how products rooted in science and industry can evolve into something deeply human. Symbols of trust, comfort, and resilience that last for generations. Have you ever opened a little blue jar of menthol ointment and instantly been transported back to childhood? That sharp, minty scent drifting through the bedroom late at night, maybe while a parent rubbed it on your chest during a cold? Those moments stick with us. For many Americans, that smell isn't just medicine. It's memory, comfort, and care in its purest form. But behind that tiny jar, behind the sensation that clears your chest and warms your skin, is a fascinating journey of science, precision, and history. And even more amazing? The story doesn't end with ointment, it stretches all the way to cutting-edge biologic medicines made from living cells. This is the hidden world of how simple remedies and advanced therapies are created, step by step, to heal millions of people across the globe. Menthol, the star of the ointment, arrives at the factory in crystalline form. If you've ever seen menthol up close, it looks like little white shards of ice. But in order to become part of a smooth bomb, those crystals must be melted carefully, with just the right amount of heat. Too much heat and the cooling effect weakens, too little and the crystals don't dissolve evenly. Camphor, another key ingredient, comes from the wood of the camphor tree or is synthesized from turpentine oil. It has to be melted at around 180 degrees Celsius to unleash its warm, almost spicy aroma. Eucalyptus oil, on the other hand, is far more delicate. It's incredibly volatile, meaning if you add it too early or expose it to high heat, it evaporates and loses its power. That's why it's added later at just the right moment so its crisp, penetrating scent remains intact. Once these oils are ready, precision becomes everything. The formulation of menthol ointment isn't guesswork. It's science measured down to fractions of a percent. Menthol makes up about 2.6%, camphor about 4.8%, and eucalyptus oil roughly 1.2%. Even the tiniest deviation, as small as 0.05%, can completely change the texture or effectiveness of the final product. Imagine if your chest rub was too watery, too harsh, or not soothing enough. That's why manufacturers treat these numbers like gospel. In huge stainless steel vats, warm petroleum jelly waits as a base. Into it, technicians slowly stir in the active ingredients. The air fills with a rich combination of scents, sharp menthol, earthy camphor, and the cool whisper of eucalyptus. For anyone walking through the plant, it's like stepping into a memory, one that hits the nose and the heart all at once. After the oils are blended, the real challenge is cooling the mixture. Dropping from about 70 degrees Celsius down to 40 might sound simple, but in practice, it takes patience and constant stirring. If cooled too quickly, the ointment could separate, leaving a grainy or uneven texture. If cooled too slowly, it could become too stiff. The goal is that familiar scoopable consistency, soft enough to spread smoothly on skin, yet firm enough to stay in the jar. Every batch goes through rigorous quality checks. Teams test viscosity, fragrance balance, and even microbiological safety. Any batch that fails, no matter how small the defect, is discarded immediately. The standard is perfection, because millions of families trust that every jar they open will feel and smell exactly the same. Once cooled and approved, the ointment is pumped into jars at high speed. Picture thousands of smooth, blue containers rolling down conveyor belts, each one filled with the bomb that will soon find its way into medicine cabinets around the world. Automated systems seal them tight to keep out air and contaminants. Labels with batch codes and expiration dates are applied for full traceability. From there, boxes are stacked, wrapped, and shipped off to pharmacies, hospitals, and homes. What started as raw menthol crystals, camphor, and eucalyptus oil has now become one of the most recognizable remedies in America. But while that little jar connects us to memories of home remedies, science has taken us far beyond ointments. In the very same era, medicine has advanced into something that seems almost like science fiction. Drugs made from living cells themselves. Welcome to the world of biologics, life-saving medicines that don't come from chemicals or powders, but from living systems. According to global research, the biologics market is exploding, expected to grow from over $533 billion in 2024 to about $610 billion in 2025. On the World Health Organization's list of essential medicines, more than 15% are biologic therapies, including treatments for cancer, autoimmune diseases, and rare genetic disorders. Unlike ointments or pills that can be synthesized in a lab, biologics start from something far more delicate, a frozen vial of living cells. And from those microscopic cells, scientists create injections that give hope to patients who often have no other options left. The story of biologic medicine really began in the 1970s with a revolution in molecular biology. Using recombinant DNA technology, scientists learned how to insert human genes into cells and essentially program them to make therapeutic proteins. The first major breakthrough came in 1982 when the FDA approved synthetic human insulin. Before that, patients with diabetes relied on insulin from animals, which was less consistent. This new biologic insulin changed everything, opening the door to treatments that could be purer, safer, and tailored to human needs. From that point on, biologics expanded into nearly every branch of medicine, from arthritis treatments to cancer immunotherapies. So how does a vial of cells turn into a life-saving drug? The journey begins with Chinese hamster ovary cells, or CHO cells, chosen because they're reliable little factories. Stored in liquid nitrogen at a bone-chilling -196 degrees Celsius, these cells are thawed with extreme care. Once alive again, they're placed into small glass flasks filled with nutrient-rich growth media packed with vitamins, amino acids, and minerals. This liquid is their food, helping them multiply until they're strong enough to move on. From there, the cells are gradually transferred into larger and larger containers, eventually reaching bioreactors that hold up to 20,000 liters. Inside these massive steel tanks, propellers stir constantly, oxygen is pumped in, and every environmental factor, temperature, pH, dissolved gases, is monitored down to the second. Over 3 weeks, the cells multiply thousands of times, each one producing therapeutic proteins that leak into the surrounding liquid. After weeks of growth, technicians harvest the bioreactor broth. At first glance, it looks like cloudy soup, not exactly something you'd associate with medicine. But hidden in that broth are proteins designed to treat deadly diseases. Using filters and centrifuges, scientists separate the cells from the liquid. The cells are discarded, but the protein-rich fluid is collected. It's strange to think about, but millions of patients around the world depend on this cloudy liquid for survival. In some ways it's not unlike brewing beer, just instead of hops and yeast these tanks brew medicine. Of course, that cloudy broth isn't ready for injection. It's full of impurities, DNA fragments, and used nutrients and stray proteins. To purify it, the liquid is pumped through columns packed with resin beads. These beads are engineered to attract the therapeutic proteins while washing everything else away. Multiple cycles and chemical buffers refine the mixture further until the protein solution is more than 99.9% pure. By the end, what started as a cloudy broth now looks like a crystal-clear solution. But it's still not finished until it passes rigorous safety checks. Every batch is tested for sterility, potency, and stability according to FDA guidelines. If even the slightest contamination shows up, the entire batch is destroyed. Only when the medicine clears every test is it filled into sterile glass vials, labeled and stored at chilled temperatures between 2 and 8 degrees Celsius, ready to be shipped to hospitals worldwide. It's incredible to think that both the simple jar of menthol ointment and the most advanced biologic injection share something in common. They're the result of meticulous precision, countless safety checks, and years of innovation. One clears a stuffed nose and warms a child's chest. The other can save a life when no other treatment works. Yet both represent the power of human ingenuity to turn raw materials, whether plants, oils, or microscopic cells, into something greater. From petroleum jelly transformed into a soothing balm, to menthol and camphor becoming symbols of care, to hamster cells unlocking the future of medicine. These stories remind us that what looks ordinary often hides extraordinary science. The next time you reach for a jar of Vicks or see a vial of medicine in a hospital, pause for a moment. Behind that container is a journey spanning chemistry, biology, engineering, and history. What seems simple is anything but. And while we often take these remedies for granted, they represent some of the most important human achievements. So if the smell of menthol ointment still brings back memories, or if you're amazed that life-saving drugs can start from living cells, let us know. Because the hidden stories behind everyday medicine are far more fascinating than they first appear.